Over the years, many men start noticing subtle but constant changes. A gradual decrease in desire, less energy during daily routines, and difficulties maintaining firmness during intimate moments. Most people tend to think that all of this is just a natural part of aging, something unavoidable, but the truth is that it does not have to be that way. In this video, I want to offer you a different perspective: how science combined with safe, natural practices can help you regain your intimate vitality without relying on invasive treatments, expensive medications, or synthetic hormones. We will talk about how the male body changes over time, which factors truly affect your potency, and how you can intervene intelligently to reverse this process. If you are wondering why I can speak so clearly about this, it is because I have been dedicated to men's urological health for over 10 years. During this time, I have worked with thousands of patients, like Daniel, 55, or Luis, 48, who are looking for the same thing as you: to feel alive, strong, and confident once again. By observing these cases, studying male physiology in depth, and exploring natural alternatives, I discovered something surprising. This video is not about magic solutions, but about a powerful and accessible tool that you probably already have at home. A natural oil, affordable and scientifically supported, that can make a huge difference if used correctly. At the end of the video, I will share with you a simple but highly effective ancestral recipe to activate your intimate health from within. There is a detail in how it is applied that changes everything. Stay until the end, because that small secret can completely transform your experience. Why does male potency decrease with age? I often hear my patients say, "Doctor, I feel like my body doesn't respond the way it used to." It is a common phrase among men in their 50s, sometimes even younger. It is not just a subjective feeling. There are real, identifiable, and treatable causes behind the loss of potency over time. One of the most well-known factors is the gradual decrease in testosterone. Starting around the age of 30, the male body slowly reduces the production of this key hormone. On average, it decreases by about 1% per year. It may seem small, but over the years, it adds up to a significant difference. Testosterone not only affects sexual desire, but also energy levels, muscle mass, concentration, and confidence. When this hormonal level drops too much, the whole body feels it. The second factor is blood circulation. A firm erection depends directly on the flow of blood to the pelvic region. For this flow to be efficient, the vessels must be healthy and unobstructed. However, over time, habits such as a sedentary lifestyle, excess sugar and ultra-processed fats, chronic stress, or smoking begin to affect vascular health. Arteries lose elasticity, become inflamed, or even partially blocked. When blood does not flow strongly enough, the body's response becomes slower and weaker. But there is a third, much quieter enemy: low-grade chronic inflammation. It does not hurt, it is not noticeable, but it is there, interfering with everything. This inflammation affects hormone production, damages the lining of blood vessels, and exhausts the nervous system. It feeds on stress, poor sleep, an unbalanced diet, and excess environmental toxins. It is one of the least addressed factors, yet at the same time, one of the most important in functional decline. When a man begins to notice that he no longer feels the same as before, it is not just about age. These are physiological processes that have quietly accumulated. What many do not realize is that these processes, although natural, can be reversed or at least managed. It is not about seeking eternal youth, but about regaining real balance, authentic vitality, and tangible functionality. That is why it is crucial to understand what is happening inside the body. Loss of potency is not an inevitable destiny. It is a message, a clear signal that the body needs support. Fortunately, there are natural ways to provide this support without relying exclusively on medications. The key is to address the causes at the root, reactivate hormone production, improve circulation, and fight that silent inflammation. In the next segment, I will show you a natural and powerful tool that works precisely on these three fronts. Something accessible, without side effects, and supported by serious scientific studies. This is not a passing trend or a magic recipe, but something much simpler and more effective. After so many years in practice, I have learned to look beyond conventional drugs. Many of my patients, like Carlos, 52, or Alejandro, 47, were looking for natural alternatives, something they could use at home, safe and aligned with their bodies. This is how I rediscovered a resource that had been forgotten for decades: castor oil. This oil is extracted from the seeds of the Ricinus communis plant, commonly known in several countries as castor bean or palm Christi. Although historically it was used as a natural laxative or to treat hair loss, today we know that its properties go far beyond that. What makes it truly interesting from a urological perspective is its high content of ricinoleic acid, a compound with multiple scientifically proven benefits. This acid has a powerful anti-inflammatory effect, which is crucial when we remember that one of the silent enemies of male health is low-grade chronic inflammation. When this inflammation settles in the tissues, it disrupts the function of blood vessels, makes hormone production more difficult, and weakens sexual response. By acting directly on this process, castor oil helps restore a more favorable environment for the body to function properly. In addition, ricinoleic acid has vasodilatory properties. This means it helps relax and expand blood vessels, promoting greater blood flow. In the pelvic region, this translates to better circulation to the sexual organs, which positively impacts the quality of erections and the sensitivity of the area. There are clinical studies supporting this effect. For example, research published in the International Journal of Pharmacy and Pharmaceutical Sciences showed that topical application of ricinoleic acid improved microcirculation in specific areas thanks to its ability to stimulate capillaries and reduce local inflammation. These discoveries, although not yet widely known, have started to attract the attention of professionals looking for comprehensive and personalized approaches to treating sexual dysfunction. Another fascinating aspect of castor oil is its mild thermogenic effect. When applied to the skin, it creates a gentle warming sensation that is not only pleasant but also stimulates blood flow in the treated area. This property makes it an ideal tool for therapeutic massages aimed at the pelvis, inner thighs, or lower back, areas closely related to male sexual function. And that is not all. Preliminary evidence suggests that ricinoleic acid could positively influence the hypothalamic pituitary gonadal axis, the system that regulates natural testosterone production. Although more research is needed, it is clear that by reducing inflammation and improving circulation, the conditions are created for the body to regain part of its hormonal balance. It is essential to understand that we are not talking about a miracle product or an instant solution. We are dealing with a tool that is physiologically aligned with what the body needs. When applied correctly and combined with healthy habits, it can be a great ally in restoring male vital energy. In the next part of the video, I will show you how to use it in practice, where to apply it, how often, and what precautions to take to achieve real and safe results. Because having the remedy is not enough, you need to know how to apply it properly. One of the great advantages of castor oil is that its use does not require complicated techniques or special equipment. It is a topical, external application on strategic areas of the body aimed at stimulating local circulation, relaxing muscles, and activating physiological processes that support sexual function. Like any natural treatment, its effectiveness depends on how it is used. First, let's talk about the recommended areas. In my clinical experience, there are 3 key zones where applying the oil gives the best results. The first is the inner thighs, right where the growing area begins. This area contains an extensive network of blood vessels that supply the genitals. Applying oil here promotes microcirculation and stimulates blood flow to the corpora cavernosa, essential structures for erection. The second area is the lower abdomen, just below the navel. Here, important nerve plexuses and vessels supply the pelvis. Massaging this area with castor oil improves muscle relaxation, reduces accumulated tension, and indirectly supports sexual function. The third area is the lower back, specifically the lumbar region. Here, multiple nerve endings converge that regulate automatic responses of the reproductive system. Stimulating this area helps release neuromuscular tension that often interferes without us even noticing. The procedure is very simple. Slightly warm a tablespoon of castor oil in a water bath. It should not boil, just be warm to the touch. Then apply it to the chosen area and massage gently in circular motions for 5 to 10 minutes. This not only allows the oil to be absorbed better, but also enhances relaxation and circulation. After the massage, you can cover the area with a clean cotton towel or a soft bandage to retain local heat for at least 30 minutes. In many cases, I recommend doing this application at night before sleeping, as this combines the effect of the oil with deep, restorative rest. Some people even prefer to leave the oil on overnight, taking care to protect the bedding. How often should it be done? Ideally, start with 2 to 3 times per week, observing how your body responds. In many cases, after 2 or 3 weeks, improvements in sensitivity, erectile response, overall energy, and mood are already noticeable. Of course, it is also important to take some precautions. Although castor oil is well tolerated by most people, those with very sensitive skin should first test it on a small area of the arm to rule out allergic reactions. It is also recommended to avoid using it on open wounds, active skin infections, or severe inflammatory conditions in the area of application. In addition, men with clotting disorders, fragile capillaries, or those taking anticoagulant medications should consult their trusted doctor first. And although this approach is aimed at male health, it should not be applied to pregnant or breastfeeding women. As I always tell my patients, consistency is key. A natural resource does not work by magic or overnight, but when applied with knowledge and discipline, it can provide real and lasting results. In the next segment, I will share an enhanced recipe that combines castor oil with other natural ingredients that amplify its effects. Although castor oil alone offers multiple benefits, over the years I have observed that its effect can be significantly enhanced when combined with other natural ingredients that work in synergy. This is one of the formulas I most often recommend to my patients for its safety, accessibility, and proven effectiveness. The base, as you already know, is virgin castor oil, preferably cold-pressed. We will use approximately 10 milliliters. This oil is rich in ricinoleic acid, known for its anti-inflammatory, vasodilatory, and mildly analgesic properties. It acts directly on the blood capillaries, promoting flow in key areas such as the pelvis or inner thighs, while calming the silent inflammation that often affects sexual function with age. To this base, we add 2 drops of lavender essential oil. This oil not only provides a relaxing scent, but also has scientifically proven anxiolytic and calming effects. Lavender helps reduce stress and nervous tension, factors that often affect sexual performance, sometimes even more than physical factors. It also helps improve sleep quality, which indirectly supports natural hormone production. We also include 5 milliliters of extra virgin olive oil, an ingredient rich in monounsaturated fatty acids and antioxidant polyphenol. These compounds not only protect blood vessels and reduce oxidative damage, but also have a systemic anti-inflammatory effect. Together with castor oil, olive oil helps improve vessel elasticity and nourish tissues from the outside. Optionally, a few drops of arnica extract can be added. This ingredient has traditionally been used to treat muscle inflammation and promote peripheral circulation. Its inclusion provides extra support in cases of accumulated tension in the lower back or muscle fatigue, especially helpful for men like Henry, 58, or Michael, 62, who experience discomfort related to sedentary habits or pelvic stiffness. To prepare this mixture, gently warm the castor oil until it is lukewarm, never hot enough to burn. Add the 2 drops of lavender essential oil, the 5 milliliters of olive oil, and, if desired, the arnica drops. Mix well with a wooden or glass spoon. The application is done the same way as with castor oil alone, a gentle massage for 5 to 10 minutes on the chosen area, preferably at night, and cover with a clean cloth to retain heat. Many of my patients report that this combination not only improves their physical response, but also creates a sense of overall well-being, more calm, more energy upon waking, and above all, greater confidence in their body. Because sometimes what seems like a simple solution is actually the result of a carefully designed formula. After everything shared in this video, I want you to take away a very clear idea. Loss of potency is not an inevitable consequence of aging. It is the reflection of internal processes that, although natural, can be modulated, corrected, and even reversed when we understand how our body works. You have learned that decreased testosterone, circulation problems, and low-grade chronic inflammation are key factors affecting male intimate health. But you also discovered that there are natural, simple, and highly effective solutions to address these issues, such as castor oil and its combination with other therapeutic ingredients. The most valuable aspect of this approach is not just its physical effect, but the opportunity to regain something many men believed lost: confidence, vitality, and the pleasure of inhabiting a body that responds. You are not alone in this process, and you do not need to rely exclusively on medications or invasive treatments. You have alternatives, and now you know how to apply them. If this video has given you clarity and motivation, I invite you to leave a comment. Tell me which city or country you are watching from, and if you want to commit to your health, write this phrase: "I choose to live with strength and health every day." It is not just a statement, it is the first step toward a new stage of well-being. Thank you for staying with me until the end, and if you want to explore further, I invite you to watch the other videos I have prepared for you with more natural tools to take care of your health from within.